Hello, welcome to our session entitled Value Added, National Standards and Research Ethics. My name is Pierre Boulos, and I will be speaking with you today on behalf of our team, Colleen Cochran, Alex Karabanow, Michael McDonald, and Munro Heesters, and Janice Parente. If we begin with the notion that REBs focus on the safety, well-being, and rights of the human research participant, we would like to engage you in a discussion with respect to these three questions. How are national standards developed from research ethics principles, policies, and regulations? How has bioethics research and practice influenced human research national standards development? And finally, what is the ethical leverage that human research national standards will provide bioethicists? National standards exist in all parts of our lives. They reflect best industry practices, and they're developed based on a consensus agreement model. HRSO, Human Research Standards Organization, is one of 12 standards development organizations accredited by the Standards Council of Canada. You may recognize some of the icons on this graph. CSA is one that we often see. HSO might be familiar to some of us. These are standards and labels that we often look for on things we might purchase, cars, car seats, and so on. We often get the question about how is a policy different from a standard or a procedure? Broadly speaking, policies answer the question, why do I need to do this? A standard bridges the policy to the procedure where we ask the question, how do I do this? By determining what is required. For instance, during a publicly declared emergency, we might come up with a policy or be faced with a policy that states that restaurants can't function at more than quarter capacity. How do I do this? Well, I restrict the number of patrons that can come into the restaurant. What's required in order to achieve that? Well, I could remove some tables, put in some plexiglass, put in stickers on the floor to tell people where to walk, to have plans for flow, and so on. But let's use another example. Informed consent. This is something that should be familiar to all of us. The TCPS informs us that consent shall be given voluntarily. How do I do this? As a researcher, if I'm obtaining consent from my participants, I would submit to the Research Ethics Board a consent process. How I'm going to get consent, from whom I'm getting consent, are they competent to consent, and so on. The standard then tells me what is required in order to achieve the carrying out of the procedure that meets the policy that I shall get consent voluntarily. Standards serve to reconcile the differences between policies, regulations, and guidelines. Standards promote consistency. We take our policies, regulations, and our guidelines and combine them in a melting pot of sorts, and we come up with a national standard. So these policies, regulations, guidelines become normative documents to help us implement standards. Why would this be helpful? Well, if you think about REBs, they function over time. They function with different people over time. I've been a chair of a research ethics board. I've functioned as an ethicist on a research ethics board over a long period of time, and different boards. But within one board, we could help ensure consistency over time by having standards. And in my experience on various Canadian REBs, I've also learned that REBs often have to collaborate with each other. They have to work with each other. A standard will enable effective oversight of multi-site research. In short, it's an assurance that we're all on the same page. I've mentioned previously as an example about restaurants during a publicly declared emergency. In such emergencies, like the one we're in right now with the COVID pandemic, proposals are often developed with short timelines and they're in need of rapid review and clearance. Standards then can be used as a reference point, especially when it comes to being prepared during public emergencies, so that we're all on the same page and know what we're doing. And while I'm on the point of standards, I just wanted to draw your attention that some human research standards have already been created. For instance, the first one that was published was the development of a human research protection program. This was published in November of this past year after a long consultation period. Another one just finished its consultation period, 2 months, from March 13th through May 14th, and is expected to be published at the end of this month or early June. And this is on the ethical review and oversight of human research. A third one is in the works right now, and notice of intent has already been submitted for the ethical review and oversight of human research during publicly declared emergencies and the conduct of human research during such emergencies. Accreditation is important, and human research accreditation is certainly important, and the role of standards is pivotal. Accreditation provides the warrant for trust, both regionally and internationally, in that there has been appropriate attention given to human research quality and safety. NSCs, or national standards, are meant for all Canadian organizations conducting human research. These standards apply to all organizations, public, private, academic, government, industry, contract research organizations, sites, biobanks, regardless of TCPS2 or Health Canada oversight. Human research in any discipline, humanities, social sciences, behavioral sciences, biomedical, engineering. Because of the broad impact of standards, technical committees to develop standards, this will require representation geographically, by sector, and by type of organization from across the country, including bioethicists. Recall earlier on, I mentioned that these standards are developed by consensus agreement reflecting industry best practices. So let's come back to our learning objectives. How are national standards developed from research ethics principles, policies, and regulations? In other words, from what are these national standards developed? In our case, they're developed from, first, the respect for human dignity and research participants. They're developed from the idea that conflicts of interests ought to be managed. And they're developed in the notion that they're contributing to the advancement of research. How has bioethics research and practice influenced human research national standards development? Well, I've pointed this out, bioethicists will contribute to development and implementation of these national standards. They will contribute to the implementation of standards. Bioethicists, by participating in REBs, are in a position to identify gaps in practice. And finally, what is the ethical leverage that human research national standards will provide bioethicists? The ethical dimensions of research are the focus, and that's the desire. not just bureaucratic and regulatory compliance. With that, I'd like to say merci and thank you for joining us on this presentation. And here are the institutions we represent in our team.